back to Bridging the Gaps in Pediatric Care, where we try to untangle some of the most intricate challenges in healthcare. And honestly, today's topic feels like trying to solve a Rubik's Cube blindfolded. I'm Theodore, and I'm absolutely delighted to be joined by Katie, a true expert in pediatric care coordination.
Thanks, Theodore. It's great to be here. And you're right, sometimes it feels less like a Rubik's Cube and more like a Jenga tower that's about to collapse, especially when we're talking about something as sensitive as pediatric hospice.
Exactly, Katie. That's why I'm so glad you're here to help us navigate the complex coordination involved. It's not just about medical care, is it? It's about families, support systems, and so many moving parts that often don't quite align.
Absolutely. The sheer number of stakeholders involved, from medical professionals to social workers, therapists, and even school systems, can be overwhelming. And then you add the emotional weight for families, and it becomes a monumental task to ensure seamless, compassionate care.
You know, Katie, when you talk about monumental tasks, I can't help but picture a hospice for adults suddenly having to care for a child. It's like asking a gourmet chef to whip up a five-star meal using only a microwave and a can of beans. It just doesn't quite fit, does it?
Theodore, that's actually a perfect analogy. Because honestly, that's often what happens. Most children in hospice care are actually being looked after by adult hospices, which, bless their hearts, are operating so far outside their normal scope of practice.
So they're basically winging it with tiny patient gowns?
Exactly, Julian. And I imagine that leads to some pretty interesting, if not slightly concerning, attempts at pediatric-friendly environments. Any memorable stories, Katie, of an adult hospice trying to adapt?
Oh, absolutely. I remember one instance where a very well-meaning adult hospice decided to create a children's corner. They painted the walls with these incredibly bright, almost neon cartoon characters that were, frankly, a little terrifying. And then they filled it with toys that were clearly for toddlers. For a teenager, it was a sweet gesture, but it just highlighted how much they didn't quite understand the unique needs.
So a fun room that was actually just a sensory overload nightmare. Got it.
Right? It's like we tried, but the effort, while commendable, really underscores the systemic issue. And then you have the communication barriers, don't you? Trying to coordinate with subspecialists when you're already stretched thin.
Precisely. Independent hospices often struggle to communicate effectively with larger healthcare systems. You're trying to coordinate with a child's cardiologist, neurologist, and maybe even an oncology team, all while navigating different electronic health records and, frankly, different institutional cultures. It's a huge hurdle.
So basically a game of telephone, but with medical degrees.
Pretty much, and I can only imagine the paperwork. Speaking of which, what about the financial side? I hear Medicaid and Medicare familiarity can be a real sticking point for hospice employees.
It absolutely is. Many hospice employees, especially in adult-focused organizations, aren't as familiar with the nuances of Medicaid and CHIP, which are often the primary payers for pediatric hospice. This can lead to missed opportunities for care or, unfortunately, reduced quality of care because they're not leveraging all available resources.
That's a huge problem. It's not just about the medical care, but ensuring families aren't burdened by financial stress during an already incredibly difficult time. And then there's the communication with the children themselves. It must be so different from communicating with adults, right?
Oh, it's entirely different. You have to consider the child's developmental stage. A conversation with a 5-year-old about their illness is vastly different from one with a 15-year-old. And then you have the entire family dynamic to consider, including siblings who are often profoundly impacted.
So no just the facts, ma'am approach then.
Definitely not. It sounds like it requires a whole different toolkit of empathy and understanding. And what about the concurrent care for children requirement, the CCCR? That sounds like it should help, but I hear its implementation is a bit of a patchwork.
It's a fantastic federal law, allowing children under 21 to receive both disease-directed treatment and hospice care simultaneously. It protects families from having to make an impossible choice. But you're right, its implementation varies wildly state by state. Many states just don't have the regulatory guidelines or support to make it truly effective.
So, a great idea, but the execution is still on dial-up.
A perfect way to put it, Julian. So, Katie, what does that mean for families? If a state isn't fully supporting CCCR, what kind of impact does that have on the ground?
It means families in those states are still facing those agonizing choices, or they're not getting the full spectrum of care they're entitled to. It adds immense stress and can delay access to crucial hospice services, which is the last thing anyone needs during such a vulnerable time.
That's heartbreaking. It really highlights the need for better, more consistent coordination. And with all these different models of pediatric hospice care, hospital-based, hospice-based, community agencies, how do we ensure continuity across all of them?
It really comes down to collaborative relationships. We need strong partnerships between hospitals and hospices and clear communication protocols. Without that, transitions can be incredibly bumpy, and that's when families can feel lost in the system.
So, everyone needs to be on the same page, or at least in the same book.
Exactly. And it sounds like leadership is key here. Hospice physicians, for example, really need to step up and take an active role in shaping pediatric hospice care, don't they?
Absolutely. Hospice physicians, or HPs, are crucial. They need to be at the forefront, developing pediatric-specific administrative and clinical policies. And engaging with state Medicaid directors is vital to really understand and support CCCR implementation. It's about advocating for these children and families at every level.
It's clear there's so much more to pediatric hospice than just medical care. It's a symphony of coordination, empathy, and frankly, a lot of policy wrangling. Katie, thank you for shedding light on these complex layers.
Sounds like they need a superhero, or at least a really good project manager.
Katie, this has been incredibly insightful. Thank you for helping us untangle this Rubik's Cube, or perhaps for showing us that we need more superheroes and project managers in pediatric hospice care.
It's been my absolute pleasure, Theodore. And honestly, if we can inspire even one person to become that superhero, then we've done our job.
Or at least get them off dial-up with the CCCR.
Exactly, Julian. A huge thank you to Katie for joining us today. And to all our listeners, thank you for tuning in to Bridging the Gaps in Pediatrics.